Hello everyone, this is your host Rohan Tandel from InnoHEALTH Magazine Studio. I welcome you to this podcast produced by Innovation Careers with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is the second chapter from the 8th edition of the virtual IC Note Club meeting hosted on the topic Transformation of Indian Healthcare System Post-COVID, brought to you by InnoHEALTH Magazine, the first magazine in India on healthcare and innovation. The topic of this podcast is Diagnostics in Pandemic, composed and narrated by Honorary Brigadier Dr. Arvind Lal.
Good afternoon, and this is Dr. Arvind Lal here. And I would first like to thank you for getting me here, and especially my mentor, my friend, philosopher, and guide, Dr. Rear Admiral V.K. Singh, and his team, ably assisted by Mr. Sachin Gaur and all the other people. So this is a topic which is a very burning topic, and thanks for asking me to speak. So the Indian healthcare system, as you all know, and especially in pandemic, we should have done better, as we are supposed to be quite high up in treatment and running tertiary hospitals, and many people from foreign countries, they come actually to India to get themselves treated, what you call medical tourism. And at one point of time, the medical tourism market in India had exceeded more than 10% of the entire workflow of a work hospital. So due to COVID, well, it has for all practical purposes, it became zero. And even people from one town to the other town were having a problem. And the system was absolutely inundated with the COVID patients. So in the first wave, we did slightly better. And there were not enough casualties, I should say. And we were able to exercise lockdowns, and it was very strictly enforced. And many people could come out of the lockdown, and we did not have many deaths in India. Having said that, there was a sense of jubilation. Many people, including in the government, including in private, many people thought that we have won over the COVID pandemic, and we announced, I think, our victory slightly early than what we should have. And that gave rise to complacency. We were not able to ensure the COVID applicant behavior, which is masking and maintaining distance, and not going for congregations, whether they are religious or they're political, etc. So that actually gave rise to the COVID endemic second phase. So if you remember your trigonometry, it is a sine wave. It goes up and down. It goes down below normal, and then it again comes up when people start, literally unmasking, collecting together, going for parties. You have seen what happens when miles of cars were, seen on the road to Mussoorie and Simla, etc. I believe as soon as the unlocking was done, in a few hours only, one mall in Delhi received 19,000 visitors, and there was no place to stand even. So you understand that we could have done without, and we have to follow the same principle which was told to us by so many people, by our seniors, by our very senior doctors. Dr. Guleria used to come on the TV very often. And that was, you have got to do, what you call T3V now. T3 is test, track, and treat. Treatment also means isolation. And V stands for vaccination. So we must not be able to forget these three cardinal principles on which the COVID, pandemic cure or management is built upon. The moment you forget one of these, well, you are in for trouble. So I am glad, being a diagnostician myself, I am so happy to note that when we were called by Professor Balram Bhargav, the DG of ICMR, And he specially called me, and I took along some other people also from my industry, from diagnostics space. And he said, Dr. Lal, you have got to lead the way and start testing for this, wretched virus, that is COVID-19 virus. And you will not believe it, at that time, there was only one, lab doing the testing. Today, I'm happy to say that there are more than 1,500 RT-PCR labs, and out of which 60% belong to the private sector. And this is not, anything unusual. You already know that 70% of the patients in India are treated in the private sector, and about 60% of inpatients also. So private sector, in other words, is the foundation of healthcare in India. And therefore, we were also not found wanting to perform our duties in the sector. So people like us have already tested millions of RT-PCR tests. And what we had never thought in our lives, this is, a patient whom we did not want to come to our labs and to our collection center because he was potentially infective. So we had to go to the patient's home, and we had to learn new things, as they say that, innovation comes at the time of great need. So this was a very big disruptor for us, and we were doing 3,000 to 4,000, RT-PCR home collections a day, and that taught us so many other things. And we tried to, keep our patients and customers happy. But when the pressure is so much, somewhere we may have gone wrong. So we were very quick to apologize and correct it. But fact of the matter is that the pandemic has come after 101 years. So it is not going to leave you and me in peace. And what do? Either we say that we ignore you. You cannot do that. So you've got to accept facts. And as I told you about the sine curve, it will go up and down. And we also have to remember that if there is no life, there is going to be no livelihood. But having said that, there are people who lost their jobs, and they were able to, daily wages workers, you've heard about these migrant cases, etc. So these people were really hard hit. So for that, since I'm not, in the government, I can't remark much, but these people also have to be looked after. The economic side of the whole thing was that it's a 20 lakh crore money had been sanctioned by the government as a special, kind of provision to get over the COVID pandemic. And I hope all that, has also gone to the rightful places. The courts are still fighting over it. The courts say that, well, every person who died should be given rightfully 4 lakh rupees by the government of India. And the government of India is not, agreeing to pay that. So these type of things are carrying on. But one thing which I have realized, and that is, which I'm sharing with all of you, is that never again in our history do we want to go through such a kind of a situation again. There were no ambulances. There were literally, people were, going from hospital to hospital to find one bed. If they reached the hospital, the ventilators were not there, the oxygenators were not there, the drugs were not there. So I think this has taught us a very nice lesson. And it is written that people who don't, learn lessons from history are then also going to repeat it and not, go further. So we are an intelligent kind of people. You have seen how Indians have done well all over the world, even in India, so well. So I have no hesitation in saying that, yes, we will come over it, provided we are responsible. And this responsibility factor starts from each one of us, and we should be able to carefully jot down our position. As I said, that I am a diagnostician. My job is to, make available all these tests for COVID. And please remember that not only COVID RT-PCR test was there. Now there's a new test known as a rapid antigen test, whose sensitivity has increased, has become much better. So maybe tomorrow, we hope the third wave does not come. But even if it comes, we should be able to get on top of it, quickly test the people, give them quick reports so they are tracked and isolated, treated, and also vaccinated. My last, prayer to all of you would be that please do not think twice about vaccination. Please go and get yourself vaccinated as early as possible. Don't start thinking Covishield lagwani hai or Covaxin or Dr. Reddy's the Russian Sputnik V vaccine, anyone which you can get on. But please don't be without a vaccine, because this can cause you so much immense harm. Let me give you statistics from England and also from UAE that 99% of the people who have died in hospitals were not vaccinated. So I'm not saying that after vaccination you cannot get infected. Yes, you can, but you will not die. You may not be put on ventilator. So with these words, I would like to thank you once again. Thank you very much.
Thank you, Dr. Arvind, for sharing your views with us. The link to listen to the full virtual meeting would be down in the description. To conclude, I would like to call out to our audience to leave a comment and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. And for more such content on healthcare and innovation, visit InnoHEALTHMagazine.com. Stay safe. Goodbye from your host, Rohan Tandil from InnoHEALTH Magazine Studio. Thank you.